Healthcare costs are playing hot potato. Welcome to In Case You Missed It. So, healthcare news this week is basically one big game of financial hot potato. But spoiler alert, nobody wants to be left holding the potato. First up, small and mid-sized businesses are getting absolutely smoked by rising healthcare premiums. A new Morgan Health report says costs are jumping around 18% for small and mid-sized employers, and I'm seeing 20s and 22s and 24s all over the place. This is not a tighten the belt moment. This is, please somebody go check to see if the belt is still attached. And small businesses feel this harder because they do not have a giant pool of employees to spread the risk around. A 500-person company can make plan changes, pull different levers than a 35-person company can. In the small to mid-sized business segment, all employers are in a pool, meaning they are subject to the health or lack thereof of the whole pool. So more stability in spreading this risk, but that's only in theory because you ask your local small business owner, doesn't feel stable, doesn't feel level at all. Second story, Medicare work requirements are coming into place. The federal government says they can save money. States are saying, yeah, cool, but who's paying to build the systems, hire the people, track the hours, verify the exemptions, update the technology, and that still looks like it runs on a fax machine and a prayer. Some states are looking at millions, others are looking at tens of millions of dollars in new administrative costs before these rules fully kick in. And that's the part that regular people might need to understand is healthcare policy is never just one switch getting flipped in Washington. They have these ideas, they put these ideas out as if it's just like, okay, go. But there's paperwork, there's systems, there are call centers, there's eligibility rules, and somewhere an exhausted state employee is trying to make a 1998 database talk like a 2026 requirement. Third story, hospitals are already seeing what happens when people drop coverage. So ACA Healthcare, one of the biggest hospital companies in the country, reported fewer ACA covered patient admissions and more uninsured admissions in the first quarter. This is bad. Red alarms. Translation, fewer people without insurance coverage, more people showing up without coverage. And when uninsured care rises, that cost does not just disappear into write-offs and clouds like deductibles nobody understands. The hospitals feel it, employers feel it, insurance companies price for it, and eventually the cost makes its way back to premiums. So what's the theme this week? Healthcare costs are not going away. They're just moving around from employers to employees, from the federal government to the states, from insured patients to hospitals, and then right back into the system like the world's least fun boomerang. This is why employers cannot treat benefits like a once-a-year renewal meeting anymore. We're looking at everything, pressing every button, kicking every tire. You need strategy, you need education, you need a broker who's not just showing up, spreadsheet, and saying, good luck, everybody. Because in this market, hope's not a strategy, and neither is pretending an 18% increase is new normal. So there's your in case you missed it. Healthcare is complicated. We're trying to make sense.